Thank you for choosing the joint replacement program at Roper St. Francis Healthcare for your upcoming joint replacement surgery. A total joint replacement can be a life-changing event, and we want to make sure you can get the most out of your treatment. This patient resource video was created to help you prepare for your surgery and learn what to expect during and after your procedure. The joint replacement program at Roper St. Francis Healthcare has 8 orthopedic surgeons dedicated to joint replacement surgery for hips, knees, and shoulders. We operate Monday through Friday at 3 of our 4 hospital locations: Roper Hospital, Roper St. Francis Mount Pleasant Hospital, and Roper St. Francis Berkeley Hospital. When you come to Roper St. Francis, you can expect highly skilled, compassionate doctors who lead the state in joint replacement surgeries. Whether you need treatment for your hip, knee, or shoulder, our goal is to get you back to the life you love as fast and as safely as possible. When you have made the decision to have joint replacement surgery, you will be given a hip or knee notebook at your surgeon's office. Although this video is a short overview of the entire process, we encourage you to read the notebook from beginning to end, as it provides detailed information to further prepare you for your upcoming joint replacement surgery. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the cartilage in your hip, knee, or shoulder joint starts to deteriorate. When this cushion or shock absorber wears down over time, you have bone on bone rubbing together, causing excruciating pain. To confirm your diagnosis, your physician will get an X-ray of the affected joint. Once your doctor has exhausted non-surgical options for treating osteoarthritis, such as over-the-counter medications, prescribed medications, and potentially cortisone injections, your next step becomes joint replacement surgery. At this point, you and your doctor have determined that surgery is necessary to relieve the pain and get you back to the activities you love. We understand that preparing for surgery can be overwhelming, and that's why we consolidate your pre-op appointments as much as possible. Our team will organize your tests and pre-op procedures so you can get into surgery quickly and safely. Prior to your surgery, someone from pre-admission testing will call you to give you specific pre-op instructions related to your medical history and current medications. They will also remind you to complete any lab work that needs to be done prior to your upcoming surgery. Please have the following information ready for this call: your medical history, surgical history, list of current medications, exact dosage and frequency taken. Your list of medications is very important. It's given to the testing nurse, and with permission, you'll be given these medications during your hospital stay. You will also learn about pre-op diet instructions from our pre-admission testing team. Some patients may be instructed to drink Gatorade or Gatorade Zero the night before and the morning of surgery. Be sure to listen carefully to these instructions, as some patients may be told not to have anything to eat or drink after midnight the day of their surgery. Unfortunately, if these specific diet instructions are not followed, your surgery will be canceled. Some medications will be allowed that morning with small sips of water only. When asked about alcohol consumption, please give an honest answer to this question. We're committed to ensuring your surgery is as safe as possible, and preventing infection is key. Here's what you can do to help prevent surgical site infections. First, tell your doctor before your surgery about any medical problems you may have. Health problems such as allergies, diabetes, and obesity could affect your surgery and your treatment. If you are diabetic, make sure you are in good glucose control. You should seek clearance from the doctor that is treating you for diabetes. Make sure you don't have any major dental issues that need to be addressed prior to surgery. If you are a smoker, we recommend that you try to quit smoking 30 days prior to your surgery. Patients who smoke are at greater risk for infections. Talk to your doctor about options that are available for you to help quit smoking prior to your surgery. We also ask that you do not shave the extremity that you are having surgery on prior to your surgery as well. If you cut yourself shaving, you will create a source of entry for infection and your surgery will be canceled. It is recommended that ladies stop shaving their legs 5 to 6 days prior to their surgery. Your surgeon's office will give you a bottle of CHG, chlorhexidine gluconate, to bathe with. This sterile scrub will come with instructions on how to use it. This is a 4-day scrub, and it should be started 3 days prior to your surgery, including the morning of your surgery, for a total of 4 days. It is a shower scrub only. You cannot sit and soak in a tub. With every scrub, you should use a fresh, clean, laundered washcloth and towel to wash and dry off with. The scrub will be used from the neck down to the toes, front and back, avoiding the private area. For the private area, we recommend you use an antimicrobial soap such as Dial or Safeguard. On the day of surgery, please bring the following items: photo ID, preferably a driver's license if you have one, insurance cards, Medicare or Medicaid cards, power of attorney, or a living will, though not required for this surgery. List of medications with the name of the medicine, the dose and frequency, and a front-wheeled walker. The day after surgery, we prefer that you wear your regular clothes from home. Pants or shorts with an elastic waistband are highly recommended. Pullover short-sleeve tops without a lot of buttons or snaps are preferred. The shoes you bring must have a rubber sole and cover the entire heel of your foot. The shoes you wear may slip on, lace up, or Velcro. Do not bring in flip-flops, Crocs, or Birkenstocks. This is a safety issue. Please make sure you bring your front-wheeled walker with you to the hospital. The physical therapist will adjust your walker to your correct height so it is safe for you to use. Make sure you label the walker with your name on it so it does not get lost or misplaced while you're in the hospital. This is the only piece of equipment you need to bring to the hospital with you. We ask that you arrive 2 hours prior to your surgery, unless your surgery is scheduled for 7:30. Admitting does not open until 6 a.m., so please don't arrive prior to that time. When you are finished with the admitting process, you will be taken to the pre-op area where they will get you prepped and ready for your surgery. The pre-op team will discuss whether you should plan to discharge home the same day as your surgery. Given the rapid advancements in total joint surgery and robust support you will receive from home health, discharging same day has become a normal part of the total joint experience. If you are discharging home same day, a wristband will be placed on your arm so the team caring for you throughout the day is aware that you are working to meet your milestones for discharge. The surgery itself, including recovery room time, will last anywhere from 2 to 2.5 hours. When you are done with your surgery, the doctor will contact your family or designated contact person to update them on the outcome of the procedure. While in the recovery room, your blood pressure, heart rate, temperature, and pain level will be monitored closely to make sure you are medically safe and stable to proceed to the next phase of care. If you are planning to discharge the same day as your surgery, you may need to remain in the recovery area or move to the inpatient joint replacement unit. If you are spending the night, you will be admitted to the inpatient unit. As with any surgery, there are risks of complication. Joint replacement is no exception. Pneumonia is a concern since our patients have been lying flat for an extended period of time under anesthesia. Also, if for any reason you do not have the opportunity to be up and walking with physical therapy the day of your surgery, you would be at an increased risk for pneumonia. The best thing we can do to prevent pneumonia is get you up and moving and walking as soon as possible. All patients will have a TriFlow incentive spirometer in their room, and the nurse will instruct you on how to use this device correctly. We recommend that you use the TriFlow incentive spirometer at least 10 times every hour while you're awake. This device will help keep your lungs expanding and will assist in moving the bad air out of your lungs and the good air in. Blood clots are also a risk. To help prevent blood clots, you will be asked to do an exercise we call ankle pumps. This is an exercise where you'll be instructed to pump your ankles up and down 10 times every hour. This exercise assists in pumping the blood from the bottom of your feet up toward the level of the heart to keep blood circulating so as not to form and develop a clot. All patients will also be wearing a sequential compression device to assist in the prevention of blood clots. This device consists of a felt sleeve that fastens in place with Velcro. The sleeves are placed on the lower legs while you are in the recovery room. When you arrive to your room on the joint replacement unit, the sleeves will be attached to a machine at the foot of your bed. This machine will inflate and deflate the sleeves, compressing the blood vessels in the lower legs to keep the blood circulating and flowing to prevent a clot from forming. Every patient will receive a blood thinner in the form of either a pill or injection, depending on your surgeon's preference. If you're already on a blood thinner, it will usually be restarted per your routine at home. After any type of surgery, it is common to experience a certain amount of pain. Joint replacement surgery is no exception. Although we will never get rid of the pain completely while you are in the hospital, it is our goal to keep it at a minimum. We use a pain scale that goes from 0 to 10, with 0 being no pain and 10 being the worst possible pain. Our goal is to keep you at a 4 or less on that scale. Although you might be experiencing some pain at a level 4 or less, the pain is usually not so severe that you can't tolerate your physical therapy. We have worked very hard on a pain medication regimen that involves the use of narcotics, non-narcotics, and anti-inflammatories to assist in the process of controlling your pain with great success. For total knee replacement patients, in addition to pain medication given by mouth or IV, there are 2 additional methods for pain control that your surgeon may choose to use for you. Some of our surgeons use a medication called ZynRelief that is injected during surgery and provides anti-inflammatory pain relief for approximately 72 hours. Other total knee surgeons use an on-cue pump to assist with pain control for 72 hours after surgery. This pump consists of a small catheter that is inserted under the tissue of the skin in the upper thigh area and will lie alongside the femoral nerve. The goal of this pump is to continuously drip numbing medication alongside the femoral nerve to assist with knee replacement pain and expedite your physical therapy. Upon discharge, if you have an on-cue pump, you will be instructed on how to remove the catheter at home after 72 hours. Another tried and true method of pain control is cold therapy. You will come out of surgery with gel ice packs on your hip or knee. It is crucial that you continue icing your surgical site for several weeks after surgery. Cold therapy, like ice packs or iceless cold therapy devices, decreases swelling and improves pain control. Please know that your safety is very important to us. To keep you safe during your hospital stay, you can never be up by yourself. You must have a nurse, physical therapist, occupational therapist, or patient care tech with you always, no exceptions. This includes going into and out of the restroom, getting in and out of a chair, or in and out of bed. We will always have bed and chair alarms in place to assist in keeping you safe from falling. Please make sure you ring your call bell for assistance when needing to get out of bed or the chair. To get you home as soon and safely as possible, you will begin working toward discharge milestones very soon after surgery. Physical therapy is one of those milestones. Your physical therapy session will consist of walking outside your room and around the nurse's station. You will practice going up and down stairs, if you have stairs at home, and you will be taught exercises that you should perform hourly in your bed or chair. Your physician or physical therapist might recommend that you be seen and treated by an occupational therapist. They will assess how well you perform basic activities of daily living, such as bathing and dressing. If recommended, occupational therapy starts the day after surgery. The goal is to ensure you are safe and performing basic self-care activities as independently as possible. Our goal is to discharge you home as soon as safely possible to minimize the opportunity for complications such as falls or infections while in the hospital. Some patients will be identified by their surgeon as good candidates for same-day discharge. These patients will work toward meeting the discharge milestones the same day as their surgery. All total hip and total knee replacement patients must pass their physical therapy evaluation. They must urinate after surgery. Their pain must be controlled with oral pain medications, and they must be able to tolerate light food and drink without severe nausea or vomiting. Our number one goal is that you are safe upon discharge. If at any point in time the nurse, physical therapist, or your physician feels it's not safe for you to go home, we will not discharge you. If you spend the night in the hospital, you will see physical therapy in the morning and continue to work toward meeting your discharge milestones. Your case manager will call you prior to surgery to discuss your discharge plan. They will ask you if you have all necessary equipment, such as a front-wheeled walker, and ask you a few questions to determine if there are any barriers to a safe discharge plan. It is imperative that you have a caregiver at home with you for at least the first 48 to 72 hours after discharge. When you are planning your surgery with your family and friends, part of your discussion should be about your discharge. While you are in the hospital, our staff will provide care for you. When you go home, your family or friends will be providing care. If you feel that it is not safe to return home after your surgery, then you might consider a rehab program. Ask your case manager for information about acute rehab or subacute rehab if you live alone or have any other barrier to discharging home safely. When you return home after discharge, we will work with you to set up home health physical therapy visits. This is the first step towards your recovery at home. You may choose any home health company that serves your area and accepts your insurance. Your case manager will provide a list that meets these requirements. Your orders for home health physical therapy will be 3 times a week for a month. They will work with you if you meet homebound criteria. This is defined as a taxing effort to leave the house on your own and an inability to drive yourself and have the required need for physical therapy. They will plan to see you within 48 hours of discharge from the hospital. When therapy determines it is safe to transition you to an outpatient setting, they will work with you and your physician to assist with this transition. If you have further questions regarding your upcoming surgery, please feel free to contact our Total Joint Program Coordinator at 843-724-2423. Thank you for choosing the Joint Replacement Program at Roper St. Francis Healthcare for your upcoming joint replacement surgery, and we look forward to working with you to ensure you get the most out of your treatment.